What do you know about breast cancer? Anything you know about breast cancer, especially from the ladies, so I can know where to start from. Even from the men. Just something simple you know about breast cancer.
It can affect even men.
Exactly. That's where I wanted to start from. Most times we think that breast cancer only affects women, but men also have breast tissue. So we start with what is breast cancer. So breast cancer is when, as any cancer is when you have your normal cells are now dividing abnormally in a rate that they shouldn't overgrow or grow in, right? So in breast cancer, it means it's your tissues in the breast, and mostly it's the ducts, the ones that milk passes through, and the what we call the lobules in the breast, so the breast tissue. But women have more breast tissue than men, so that's why we find more causes in women. But the most common cause is genetic factors. So when you come to breast cancer, what causes breast cancer? Genetics play a very big role. So we have two genes. I'll just tell them. It's too medical, but you'll hear about this word a lot, since there'll be a lot of information on breast cancer. So it's called BRCA1 and BRCA2. So BRCA is BRCA1 and BRCA2. So these are gene mutations. And this is the reason why breast cancer is mostly family history related. But that doesn't mean that women who don't have a family history can't get it. But the most common cause is this gene mutation, the BRCA1 and the BRCA2. So BRCA1 is the one that causes cancer in females. Then the males who have gene mutations in the BRCA2 are the ones that we find who have cancers. But BRCA2 mutations are on the low, BRCA1 are on the high. That's why we have less men suffering from breast cancer, but men can get breast cancer. So it's normally inherited in families. Some women might miss it, but some might find it. If there's one woman in a family history with breast cancer, there's a high chance one other woman in that family history will get it. There's something we call autosomal dominance. It's how genes are passed down in families. So breast cancer is one of those cancers that if one woman has it in the generation, it will have to be passed down. So that's why it's good for women to ask. You know, we don't ask our parents or our grandmothers, what did my great-grandmother die from? That's a very important question we never ask. Even for men, what did my dad die from? When we're talking about prostate cancer. So family history is a very important thing when it comes to breast cancer. So you need to know your risk, know what's normal for you, get screened, and also making healthy lifestyle choices.